Hello, Senator Settle. My name is Emily Angle, and I'm one of your constituents from Alexander County. I'm also a registered nurse, clinical nurse educator, and a graduate student in the Master's of Science in Nursing Nurse Educator program at the University of North Carolina, Wilmington. Thank you for taking the time to meet with me today to discuss North Carolina Senate Bill 966, also known as the SAVE Act. As a member of the Senate Healthcare Committee and the senator representing our district, your leadership is important in addressing healthcare access, workforce capacity, and the future of nursing practice in North Carolina. Today, I'm asking for your support of Senate Bill 966. North Carolina continues to experience healthcare workforce shortages, particularly in rural and undeserved communities. These shortages contribute to longer wait times, delayed care, and difficulty accessing healthcare services. Advanced practice registered nurses, or APRNs, are already helping meet these needs, but current regulations may prevent them from practicing to the full extent of their professional training. The SAVE Act would modernize advanced nursing practice by establishing statutory definitions for the 4 APRN roles, creating APRN licensure through the North Carolina Board of Nursing, and allowing APRNs to practice within their scope of expertise. It would also modernize regulations related to prescribing and other aspects of advanced nursing practice. Although I'm not an advanced practice nurse, I have seen the impact of healthcare access throughout my nursing career. Before becoming a clinical nurse educator, I served as a school nurse here in Alexander County. In that role, I worked with students and families who often face barriers to timely health care, including limited provider availability, transportation challenges, and delays in receiving care. Those experiences taught me that access to health care isn't simply a policy discussion. It affects real people every single day. Although my role has changed, the challenge has not. Today, as a clinical nurse educator, I continue to see how provider shortages and timely access to care affects patients throughout our healthcare system. Here in Western North Carolina, distance, transportation, and provider shortages can make it difficult for patients to receive the care they need. Allowing qualified APRNs to practice to the full extent of their training can help improve access while strengthening our healthcare workforce. Current evidence supports this approach. Research by Dunbar, Jacob, and Rohe in 2025 found that states with full nurse practitioner practice authority had better access to care, higher overall health ratings, and improved health outcomes. Another 2025 study by Johnson and colleagues found that APRNs in full practice authority states provided more services across healthcare settings. Most recently, Fitzpatrick and colleagues reported in 2026 that full practice authority was associated with increased nurse practitioner-led visits and fewer non-urgent emergency department visits. Together, these findings suggest that modernizing APRN practice can improve healthcare access without compromising quality. I also recognize that some healthcare professionals have concerns about expanding APRN practice authority, particularly regarding differences in education, physician supervision, and patient safety. Those concerns deserve thoughtful discussion. However, the SAVE Act does not eliminate professional accountability. APRNs would continue practicing within their licensed scope and remain accountable to the North Carolina Board of Nursing. The SAVE Act does not eliminate collaboration. Healthcare is strongest when physicians, APRNs, nurses, pharmacists, therapists, and other healthcare professionals work together to provide the best possible care for patients. Senator Settle, Senate Bill 966, the SAVE Act, offers North Carolina an opportunity to strengthen our healthcare workforce and improve access to timely, high-quality care, especially for patients living in rural and undeserved communities. As your constituent and a registered nurse, I respectfully ask that you support Senate Bill 966 and help move the SAVE Act forward for the people of North Carolina. Thank you again for your time, your thoughtful consideration, and your continued service to the people of Senate District 36 and the state of North Carolina. Thank you.